All right, so today we'll look at nervous tissue. So nervous tissue is a specialized type of tissue. Specialized in the sense that this is the only tissue in the body that has the following abilities. Number one, initiation of electrical impulses. Number two is conduction. Number three is transmission. So nervous tissue can initiate, conduct, and transmit electrical impulses among similar cells and also with other types of cells in the body that have the ability to conduct impulses. Example given is muscle. So muscles are able to conduct electrical impulses, but lack the ability to initiate their own impulses. That being said, we go straight into discussing this tissue. So what is our focus for today? For today, we're going to discuss the kind of cells found within nervous tissue and how these cells can be classified. Then we'll go on to look at what type of functions these cells perform within the nervous tissue. Okay, so we're not discussing nervous system, but nervous tissue. Okay, so nervous tissue is tissue composed of mainly two distinct types of cells. In other types of tissue we discussed, for example, epithelial tissue, we looked at cells having different types of shapes. Connective tissue, we looked at different types of cells, resident cells and transient or temporary cells. Now, in nervous tissue, we can categorize the cells of nervous tissue into two categories. We have excitable cells, which we call neurons, and non-excitable cells, which we call glial cells or neuroglial cells. Now, neuroglial cells do not conduct impulses, so they are not involved in electrical impulses. Rather, these cells act as connective tissue of the nervous tissue. Okay. And we said connective tissue performs mainly two functions in the body, that is physical support as well as metabolic support. And we will see that these neuroglial cells will be able to achieve both of those functions of connective tissue, that is physical as well as chemical or rather metabolic support. So when we look at neurons, so we're saying we have excitable cells and non-excitable cells. Now, we'll start with the excitable cells, which we call neurons. Neurons are the actual cells of nervous tissue that perform the functions of nervous tissue. Now, what are some of the differences from the cells that we discussed earlier on? We discussed connective tissue cells, also discussed epithelial tissue cells. These are the following differences that we find in nervous tissue cells, to be specific, neurons. Number one, the cytoplasm is given a different name in nerve cells or neurons. The cytoplasm is known as the pancreon. So pancreon is the cytoplasm of nerve cells. Then the cell body, the body of the cell, like the central part of the cell, is known as the soma. Soma or pericardion, or simply cell body. Cell body is known as soma or pericardion or cell body. So we usually call them as cell bodies. Apart from that, the cytoplasm of nerve cells has higher concentration of rough endoplasmic reticulum. And we said rough endoplasmic reticulum, its function is to produce protein whose function is outside that cell. So in the nerve cells, rough endoplasmic reticulum is given a special name as Niseo bodies or substance. Next is nerves have dendrites and axons. That's a dendrite, plus one axon. So this is a cell body or soma or perikaryon. Then the cytoplasm known as penikaryon. Then we are saying, in addition to that, we have this extension, the longest one being the axon. Then these shorter ones, we call them dendrites. Now we're saying the point here where the axon originates from, we call it the axon hillock. This is the axon hillock. And we find that this is the area where we find the highest concentration of rough endoplasmic reticulum, as we can see in this diagram. Rough endoplasmic. So the Niseo substances or Niseo bodies are closer to the origin of the axon. This is for a special reason, because these rough endoplasmic reticulum in nerve cells, they are specialized to produce a special type of protein known as neurotransmitter. So neurotransmitters are produced here in the rough endoplasmic reticulum. Then they are transported to the axon. That's why they are just near there. So once they finish producing neurotransmitters, they can easily go into the axon. Next is the axon is just an extension of the cell membrane. If you look at this structure, you see that there's no closure there. There's no closure. So meaning the fluid inside the cell body will go to the dendrites, and also go to the axon. There's no limitation. So the same fluid you find here in the cell body will be found in the axon as well as dendrites, the same cytoplasm we're talking about. Because of that, you see that the axon, being an extension of the cell, it is also covered in cell membrane. This is cell membrane. It goes on like that. It goes on. Even the dendrites have cell membrane. Okay? So the cell membrane of the axon has a special name. We call it the axolemma. Cell membrane of axon, we call it axolemma. Then the fluid found in the axon, we call it the axoplasm. And you see that this is just cytoplasm, except it is found in the axon. Okay. Apart from that, we say when the axon, as it is elongating like that, it branches off. It forms branches at the end there. So this is axon. Then it splits into several processes. We call these as axon terminals, or what we call terminal boutons. B-O-U-T-O-N. These are terminal boutons. Now, these terminal boutons will go and attach to the next cell. So terminal boutons will come and attach to the dendrites of another nerve, will come and attach or come closer to the cell body there, or will go and attach to either a gland or a muscle. So axons make connections or communicate with dendrites, number one, communicates with cell bodies of other nerves, number two, communicates with cell membranes of muscles, number three, and also communicates with glands in the body, that is four. So the axon splits in half. So one axon can have attachment to so many nerve cells. Okay, maybe let's say we have 1, 2, 3, 4, 5, 6 terminal axon terminals, meaning each terminal will attach to something, either a muscle, a gland, or another nerve cell. And that's how they make connections within the body. Now, as they make that connection, there is no physical contact with those structures we've mentioned. So there will be no physical contact between axon and axon, between axon and dendrites, or axon and muscle. There's always a small space, and that space is known as a synapse. So that synapse prevents physical contact between axon terminals and the organs or the other cells that it is interacting with. And therefore, the chemical that was produced by the nasal substance or rough endoplasmic reticulum we are calling neurotransmitters are stored in the axon terminals. They are stored here. So that when this nerve wants to communicate now, finally, with the next cell or muscle or gland, instead of electrical impulses being channeled to the next cell, the axon just releases those neurotransmitters into the synapse. And then the neurotransmitters will activate the cell that this nerve cell is trying to communicate with. Okay. Because of that, the synapses are given different names. You can call it a neuromuscular junction if it is a synapse between a neuron and a muscle. We can call it a neuroglandular junction if it is a synapse between a neuron and a gland. Okay. Neuromuscular between neuron and muscle, neuroglandular between neuron and gland. Then synapse when it is communicating between neuron and neuron. Okay. So here we are seeing a neuromuscular junction. This is a nerve, that is a nerve also. So we see that is a blood vessel. Now within blood vessels, we have smooth muscles. So here it is magnified further. You see that the terminal axons appear as though they are in physical contact with the muscle, but actually there's a small space in between known as the synapse. Already talked about nasal substance. So all other organelles that we saw in basic structure of the cells are present in the nerve cells. All other organelles are present in nerve cells. Mitochondria is present, except centrioles are absent in nerve cells. So centrioles are not present in nerve cells. They're absent, and that is why nerve cells do not undergo mitosis. They don't increase in number. Okay, once the brain matures, they can't multiply any further. And that's why if at 5 or 6 years somewhere there, let's say we have 20 billion neurons, they will remain like that into adulthood. But once we start aging, the number of cells begin to reduce, cells begin to die. So now let's look at the neurons and its part. So I was explaining the cytoplasm. We say dendrites. We have explained these are cytoplasmic extensions. Same with the axon, except the axon is much longer than the dendrite. So the basic part of a neuron involves 3 parts: dendrites, soma or cell body, and axon. That's all. Axon, cell body, dendrites. Now, dendrites are specialized to receive impulses from other nerve cells. So these are receivers. Whereas the cell body is specialized to initiate impulses, conduct impulses, and transmit the impulses to the axon. So this is where interpretation of impulses occur in the cell body. For example, thinking, reasoning, planning, such kind of processes is within the cell body. Dendrites is just to receive that command. Then axon is to transmit the impulse from the cell body to the next cell. So dendrite, they are receivers. cell bodies, these are control centers. Then axons are transmitters. And that's why nerves can initiate, transmit, and conduct electrical impulses. Now, we see that nerves, if I take you back to this, nerves, this is the whole nerve cell, then this is axon. So when nerves in the body, that is the brain, spinal cord, and peripheral nerves, these axons are bundled up together. So they form bundles. So maybe you have maybe 100,000 nerves, axons, and those who form a peripheral nerve, they form more like a cord, which is shown here. So what we are seeing inside this is sorry for that interruption. Lost some signal here. So we'll just continue from where we left off. Okay, so what I was trying to explain is that axons, a collection of axons, millions of them, forms what we call nerves. Okay, not neurons, no. So usually when we say nerve, to be specific or to be more accurate, we mean a collection of axons. But we use nerve and neuron interchangeably. But when you say neuron, you mean the whole cell, axon, dendrites plus cell body. But when you say nerve, it means we are talking about axons, a collection of axons. So what we are seeing here is one nerve, for example, sciatic nerve, the common nerve, especially when it comes to nursing. So for example, this is a sciatic nerve. Now, what is found inside there? So first of all, the nerve is covered in connective tissue. The whole nerve, meaning what is inside are bundles of axons. So it is covered in connective tissue. And that layer of connective tissue shown here is known as epineurium. Epineurium. Then we see that bundles of axons are covered also in connective tissue to form fascicles. So this is one fascicle. This is another fascicle. So you see that this is a different bundle. That's another bundle here. Now, we are saying within a fascicle is a collection of so many axons, each axon connected to one cell body. So like here, we can't even count. There are so many axons there. So we call that as a fascicle. And each fascicle is surrounded also by connective tissue. Like this one, this is fascicle, this is fascicle. Now, the connective tissue surrounding a fascicle, we'll call it perineurium. So that is perineurium, covering a fascicle. Then we're saying inside each fascicle, there are millions of axons. Like this is one axon. And each axon now is covered in another layer of connective tissue. This time we are calling it endoneurium. So this is endoneurium. Perineurium covering a fascicle, then epineurium covering the whole nerve now. So you see what we call a sciatic nerve is not one axon, no. It's a million of axons in it, coming from different cells in the brain and spinal cord. Then we see that within the nerve, there are blood vessels, that is artery and vein, to provide nutrients and gases to these cells. Because these cells are living, they will need nutrients and gases. So this structure here is what we are seeing on the other end. This is vein, this is artery. That is one fascicle, another fascicle, another fascicle. So we're saying connective tissue surrounding a fascicle is perineurium. Is what you're calling perineurium here, labeled P. Then each nerve or axon within a fascicle, like here, we are just seeing dots representing axon. Each axon is covered in endoneurium. Then the whole fascicle now, like here, this is the whole fascicle, is covered with epineurium, which is labeled E. That is connective tissue. So this is organization of nerves. They are always supported with connective tissue, which brings blood vessels and lymphatics to nerves. So these coverings we are calling epineurium, perineurium, and endoneurium. They are there to bring blood vessels to the nerves, apart from organizing nerves properly. Okay, so this is where we are. I've explained what endoneurium is. It covers axons. Perineurium covers the fascicle. Then finally, epineurium covers the whole nerve now. Okay. This is the same structure shown here. Perineurium, meaning this is a fascicle. So this is fascicle, that is fascicle. Then each nerve, each axon, sorry, like this is one, will be covered in endoneurium, which is labeled EN here. Then you find blood vessels now that are bringing nutrients and gases to nerves. Equally here, this is one fascicle, 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 blood vessels. So here we're going to have perineurium. Then around each nerve, we're going to have endoneurium. Then the whole nerve now around will be covered in epineurium. Okay. So we look at now, this I already explained, dendrites and axons and their functions. We look at so this is a summary of parts of the nerve cell and their functions. Now look at classification of neurons. Remember, there are also support cells. We'll talk about support cells when we're done with the axons. So how do we classify neurons? So the first classification is number of processes. Number of processes. In short, how many dendrites, how many axons does the cell have? How many dendrites and how many neurons, axons are present? Then you can classify it. So based on that, the first type of neuron is that which has one extension from the cell body. Okay. I'll go to the, I think I have a summary somewhere where all of them are shown to be easier for me to do so. Which one? Where is it? Okay. Nevertheless, we can use this. Total the diagram showing summary of all of them. Anyway, let's begin with unipolar. So unipolar, we are calling it unipole because first of all, you have a cell body here. Under normal circumstance, we should have an axon like the way it is here. Then we should have dendrites on the other side also. But a unipolar neuron, also called the pseudo-unipolar neuron, is the same one here. This neuron has a cell body, but no dendrites there. So what happens is the axon comes from the cell body, then splits in half. One part will act as a dendrite, the other part will act as an axon. Dendrite, axon. But all of them connected to the cell at one point here. So we call this as unipolar or pseudo-unipolar neuron, because it only has one pore where extensions are coming from the cell body. The other pore here is completely blank. Bipolar, meaning on both sides of the cell body, there will be extensions or processes. So there are two. This side we have one dendrite that splits into many branches. The other side we have an axon that will split in branches, giving the terminal axons as well. So this is bipolar because we have this pore which has process, the other pole also with its own process. Okay, so most of these special senses we have in the body, for example, the eye, the tongue, the nose, and the ear have bipolar neurons in them. So the neuron that collects sound from the ear, we call it the auditory nerve. All auditory nerves appear like this. Dendrites on the other end to collect sound, axons on the other end to transmit sound to the brain. Same with eye. Dendrites in the retina, axons connecting to the brain so that we can interpret the light that we see. So that is bipolar, found in all special senses of the body: eye, tongue, nose, ear, and some in the skin also. What about multipolar? So multipolar is the commonest type of neuron in the body. This is the most common type of neuron within the body. So majority of cells are multipolar. Why do we call them multipolar? It's because you have on one end, we have one axon. Then on the other end, we have dendrites. Now, these dendrites are originating as independent dendrites. If you compare with the previous one, it's one dendrite, then it splits in so many processes. But on a multipolar neuron, each dendrite has its own origin from the cell body. Therefore, there are so many poles. This one here, then so many dendrites. So it has several dendrites, all of them originating direct from the cell body, and only one axon. This is the most abundant type of neuron in the body. Okay. So those are the types of neurons we have in the body: multipolar, bipolar, pseudo-unipolar, and unipolar neurons. Okay, so that's how the first classification of neurons, we are looking at number of processes, how many dendrites, how many axons. Let's look at another classification. Now, we can also classify neurons based on the length of the axons. So, neurons that have long axons, we call them Golgi type 1 neurons. Neurons with short axons, we call them Golgi type 2 neurons. Or you can simply say type 1 neurons and type 2 neurons. Where do we find Golgi type 1? So Golgi type 1 neurons are found in the cerebral cortex, what we call gray matter. So the brain has Golgi type 1. Then in white matter, we can find Golgi type 2 and also in the spinal cord. But majority of nerves in the spinal cord are Golgi type 1. Just look at how long the spinal cord is. So we need longer axons there. Maybe the cell body is in the brain, but the axon will extend all the way from the brain, maybe into the neck region of the spinal cord. So those are long, are neurons with long axons. So we call them type 1 and type 2 neurons. We can also classify neurons based on whether they are taking impulses to the brain or they are taking impulses away from the brain and spinal cord. So we have two types under that. We have sensory neurons and motor neurons. So sensory neurons. So we call this as functional classification. So we're not looking at the shape. We're not looking at how long the axons is. We are just looking at function. Is it carrying impulses from body parts to the brain and spinal cord, or is it carrying impulses from the brain and spinal cord to the body? So if a neuron is carrying impulses from body parts, that is organs, muscles, and glands, to the spinal cord and brain. We call them as sensory neurons. So sensory neurons receive impulses or stimuli from the body and external environment. Okay. And they are given further names as primary, secondary, or tertiary. So the first nerve, for example, in the skin, this is a nerve receiving, for example, stimuli of coldness. To know that the skin is cold, the temperature there is cold. So the first nerve to receive that, we'll call it the primary neuron. So this primary neuron runs from the skin and enters into the spinal cord. From there, another neuron will pick it up. We call it now the second order neuron, or simply secondary neuron. Secondary neuron will run from the spinal cord to the brain. In the brain there's a part known as the midbrain. In the midbrain, we find another part known as the thalamus. This is where second or secondary neurons end. They can't go to the cortex, the superiormost part of the brain. They just end in the brain stem. From the brain stem, another neuron will pick that information and take to the cortex. So we call that the final nerve as the tertiary neuron, or simply third order neuron. This is a neuron that will take impulses to the gray matter. But all of them are taking impulse in one direction. That is from the body to the brain and spinal cord. What about motor neurons? Motor neurons are classified as upper and lower motor neurons. So motor neurons transmit impulses from brain back to body parts, that is muscles, organs, and glands. So the first neuron that will leave the brain, so it starts from here, from the brain, all the way into the spinal cord. We call it upper neuron because it is superior to the one that is below it. So we call it upper neuron. Then the lower neuron will originate from the spinal cord, leave the spinal cord, and go to the body parts, muscles, glands, and other organs. So we'll call that as lower motor neurons. But at the end of the day, both are transmitting impulses from the brain, from the spinal cord, to the body parts. So that is functional classification based on their functionality. Okay. We can also classify neurons as being parasympathetic or sympathetic. Now, under that division, we just look at, is this neuron involved in conscious control or subconscious control? So all neurons involved in subconscious control, we call them autonomic neurons. All neurons involved in voluntary or conscious control, we call them somatic. So somatic are nerves or neurons that control skeletal muscles, things that we are conscious about, movement, writing, sitting, running, all those things. But involuntary actions, for example, digestive processes, pupil reaction to light, coughing reflexes, all those are automatic. Heart rate, breathing rate, all those things, blood pressure, they are under subconscious control. So the nerves involved are autonomic. Now, under autonomic, we have two types. That is parasympathetic neurons and sympathetic neurons. At this stage, I just want us to know that parasympathetic neurons have specific points of the nervous system where they originate from. All parasympathetic neurons originate, number one, from the brain. These are nerves we call cranial nerves. We have cranial nerve number 1 up to cranial nerve number 12. Those belong to the parasympathetic. Then we also have parasympathetic nerves that originate from the sacrum. So here, that is brain, that is sacrum. So these are parasympathetic as well. That's why you say parasympathetic, its origin is cranial, meaning head, sacral, meaning sacrum. So it's cranial, sacral. What do they do in the body? Parasympathetic neurons restore body functions to normal. Also brings about rest and healing to the body. So these are neurons that will relax the body, allow the body to rest, and also promote healing. For example, when you are sleeping, the parasympathetic neurons are more active because when you are sleeping, a lot of processes occur, but we are not even aware. The only part in the body where parasympathetic neurons stimulate instead of causing the body to rest is the digestive system and the reproductive system. So during ejaculation and orgasm, the parasympathetic nervous system is active. And if there's damage in this system, then those processes I've explained will cease to occur. Digestion is affected, equally sexual excitement, sexual climax is affected. Sympathetic neurons. Sympathetic neurons, their origin is different from parasympathetic. The origin of sympathetic is within the chest region, which we call thoracic region, and the lumbar region, which we call lumbar. So in terms of origin, sympathetic is called thoracolumbar. The origin of sympathetic neurons is thoracolumbar. Thoraco meaning thoracic region, lumbar meaning lumbar region. What is the importance of sympathetic neurons? So sympathetic neurons bring about flight, fight, and fear. All these, you find that are protective mechanisms. Human beings should have capacity to fear, because we don't fear you see a lion coming, you don't fear be eaten. So fear is part of survival. Control of fear is also important. Then flight is to run away in case there's danger. Then fight, in case you are cornered, you have no way of escaping. You should find a way of escaping that potential danger, so you should fight. All these activities are controlled by sympathetic nervous system. So it sympathizes with us, with the human beings. And as a result, you find that when the sympathetic nervous system is active during day, like during daylight, that's when it is most active. Then parasympathetic is active during sleep. Okay. Then other neurons now. We can now go to, okay, so we said autonomic is for unconscious control. Then voluntary control, we said, is somatic. So these are neurons that control all voluntary actions in the body, mainly skeletal muscles. Okay. So that's all about classification of neurons. We classify neurons based on control. Under control, we have sympathetic, parasympathetic. These are involuntary neurons. Then voluntary neurons, we have somatic neurons, neurons that control all skeletal muscles in the body. Then function, we have motor neurons and sensory neurons. Okay, then based on processes, we have unipolar or pseudo-unipolar neurons, bipolar neurons, and multipolar neurons. Then length of axons, we have Golgi type 1 neurons and Golgi type 2 neurons. Okay. So gray matter, I'll skip that. We look at myelin formation. Now, as we were looking at the axons, we saw that some axons have myelin on their surface. So we said the cell membrane of axon is axolemma. So the axon, some axons, not all axons in the body are myelinated. It's only large axons. Small axons are not myelinated. Now, large axons in the body are myelinated to speed up their process of transmission. So if you ask me, you see that large axons are faster transmitters, whereas small axons are slow transmitters. Let's look at that in detail. What we have here is an axon. The cell body is somewhere here together the dendrites, but it's removed anyway. Now, this is axon. This is the same structure here. We're just seeing it from a different angle from here. So what happens is axons, since they are large, they forget about the small one. They are not myelinated. The large axons are myelinated because they have to be insulated to prevent, short circuiting in the body, because axons transmit electrical impulses and they travel longer distances. To avoid impulses being channeled to other cells where they are not intended, we need insulators. So think of axons like electric cables. The generating plant is somewhere far, for example, in Mamba. Then you have wires coming, for example, to Mazabuka, even Lusaka. Now, to prevent short circuits, electric cables are separated from one another. Same thing occurs in the nervous tissue. To prevent these nerves interacting with each other unnecessarily, they need insulators. So myelin sheath is nothing but insulator of axons. So what we are seeing here is a process known as myelination. Now, myelination is achieved by two types of cells. We call them Schwann cells and oligodendrocyte. Schwann cell and oligodendrocytes. Now, what happens is these two cells are specialized to store fat in their cytoplasm. Once they do that, they begin to wrap themselves around the axons, as you can see here. From 1 to 2, the cell is wrapping itself. There it was just on the top surface. Now it will wrap and envelope the axon. That is what is happening here. Now, once that occurs, these two cells, Schwann cells and oligodendrocyte, they leave small gaps, like you can see here, there, and there. These gaps are known as nodes of Ranvier. Nodes of Ranvier, these are small gaps, meaning the entire axon is insulated except at the nodes of Ranvier, here and there. The rest is covered with Schwann cell or oligodendrocyte, and we call that as myelin sheath. And since these cells store fat in their cytoplasm, and we said fat is a bad conductor of electricity, meaning these portions, this one, that one, that one, where there's myelination, become insulated and they can't participate in transmission of impulses, leaving only these nodes as spaces or areas of the axons which will participate in transmission of impulses. Therefore, these nerves transmit impulses much quicker, and such kind of transmission is known as saltatory conduction. So saltatory conduction is the most rapid or fast way of transmitting impulse to the next cell, and that is achieved only by myelinated nerves. And we said it's only large nerves that are myelinated. The smaller ones are not. So if it was a small one, it will remain plain like that, meaning the whole axon should participate in electrical conduction. Electrical conduction begins here, so it has to travel all the way on the cell membrane and reach there. That is for small axons, traveling all the way. But for these large axons, only here. So impulse will jump from here to there, 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 faster. This one is moving slow, while this one is jumping. So this is saltatory. And as it is in small, where it goes continuous, we call that as continuous conduction. And that is very slow, only seen in small axons which lack myelin. So I've already explained the function of myelin sheath. Okay. Even synapses, I explained the synapse is simply the gap left between two neurons. So that is a dendrite cell body axon. Dendrite cell body axon. Dendrite and axon, they are interacting. So there's a small gap there that we call axon. So the neuron that is trying to communicate with the next neuron is what we call the pre-synaptic, because this is where the synapse is. So you can call it as pre-junction neuron, because this is where the junction is. So this is pre-synaptic neuron, then this will be post-synaptic. Pre, before synapse, post, after synapse. Okay. Again, this is the synapse in more details. I was explaining to say the terminal ends of axons, these store what we call neurotransmitters, which are secreted by the rough endoplasmic reticulum, here called the nasal substances. When those neurotransmitters are stored here, when this nerve, an impulse comes here on the cell membrane of the axon and reaches the terminals, the electrical impulse stimulates the stored neurotransmitters here to be secreted into the synapse. Once that occurs, the next cell will be stimulated also. So here we are saying it was electrical impulse, but at the synapse, it is chemical impulse. So in the synapse, the message is chemical. On the axon, the message is electrical. So nerves conduct electrical impulses, but at the junction, the impulse is converted to chemical because it has to release these neurotransmitters, which will go on to activate another cell to begin their own electrical conduction. Okay. So there are so many types of neurotransmitters. I will not go into that. Physiology does justice in that. So for me, I'll just end here at neurotransmitters. Okay. Now we look at neuroglial cells. Remember, neuroglial cells are cells that are not involved in transmission of impulses. We said these cells act as connective tissue cells of the nervous tissue. They are there to support physically as well as metabolically. So there are several types. We call them number one, astrocytes, oligodendrocytes, and ependymal cells together with macroglial cells. So these are the four types of neuroglial cells we have. Okay. In the central nervous system. Then in the peripheral nervous system, we have Schwann cell and satellite cells. So we have the nervous system is divided into two parts, central and peripheral. So before we even go any further, I want you to note the following. Schwann cell, I'll label it like that, and oligodendrocytes are similar cells. Schwann cell and oligodendrocyte perform similar function. These cells form myelin sheath. This process here, this process is achieved by Schwann cell and oligodendrocyte. The only difference is Schwann cells form myelin sheath in the peripheral nervous system, whereas oligodendrocytes form myelin sheath in the central nervous system. What is the function of myelin sheath? Is to act as insulator. So both cells, Schwann and oligodendrocytes, store fat in their cytoplasm, which will act as insulator when they form myelin sheath. So let's begin to look at them one by one, starting with astrocyte. Astrocyte is known as a star-shaped cell. So study of stars, we call it astrology. So that's where it should be Latin or Greek. Greek, astro means star. So if you look at this cell, it appears like a star. Central part with a nucleus and these sharp processes. So astrocytes are abundant cells in the central nervous system. There are a lot. They are the most abundant cells of the nervous system. Next to neurons, we have astrocytes. So among the neuroglial cells, astrocytes is the most abundant cells. What do they do in the body? Astrocytes help to form what is known as a blood-brain barrier. So astrocytes form the blood-brain barrier. At the same time, they regulate what type of nutrients or what type of chemicals the brain cells are exposed to because of the barrier that they create. Okay. At the same time, they protect neurons so that they develop. Okay. And then once neurons die, the space left is filled by astrocytes. So astrocytes in people who have had a stroke where nerve cells died, the area where there was nerve cell, instead of forming a scar, like the way we have scars in muscles and skin, we don't have scars in the brain. Instead, that area will be filled up with astrocytes, and that area ceases to perform the function it was performing because the cells have died. So if that area was controlling speech, then speech becomes impaired because the cells are no longer there that command the tongue to speak. Okay. Now, how do they form the blood-brain barrier? Because these cells are more like stars. For example, this is the cell. The other cells are hidden somewhere. The cell body is not showing. We're just seeing their processes here. Their processes have these terminal ends, which we call foot processes. So these are foot processes. The foot processes cover all blood vessels in the brain. So they form like an extra layer around the blood vessels of the brain. And because of that, only certain type of substances are allowed to diffuse from blood vessels through the capillary wall, through the foot processes of astrocytes, and reach where the nerve cells are. As a result, what we are seeing here from the membrane of the capillary and the foot process is what we call the blood-brain barrier. There's a barrier between blood that is inside the capillary and cells. Nerve cells will be here. So not everything in blood can cross this layer from blue part up to the yellow part here. Only few substances, for example, alcohol, certain drugs like barbiturates, find it easy to cross this layer. Okay. And that's why you see that not all drugs in the body can influence the central nervous system. They have to be made in such a way that they have the ability to pass through these layers and reach where the nerve cells are. And that's why even those that have the ability to cross the blood-brain barrier don't reach their full concentration early. It takes time. For example, if you're administering amphotericin B Yes, it crosses the blood-brain barrier, but at a slow pace. Therefore, you have to continuously infuse the patient. Okay, so that's about astrocytes. They are there to form the blood-brain barrier, fill up space left by dying neurons, assist in the growth of neurons, and control the amount of substances or type of substances reaching neurons. Okay, then we look at oligodendrocytes. Now, oligodendrocyte, I was explaining, say this forms myelin sheath. To be specific, within the central nervous system. Its cousin is Schwann cell, which forms myelin sheath in the peripheral nervous system, shown here. So Schwann cell is also known as neural hemocyte. Now, the difference is as follows. One oligodendrocyte can provide myelin sheath to a lot of neurons, maybe even 100 plus, just one cell. So it will extend a lot of extensions from the cell bodies to go and cover so many neurons. Like here, you see this is one oligodendrocyte. It is covering this cell, and that cell, or axon, sorry. This axon, that axon, this axon. So 1, 2, 3, 4. Okay. So you may have few oligodendrocytes, but the number of neurons they are going to myelinate is a lot. Therefore, in terms of number, we have few oligodendrocytes, but what they cover is all large axons within the central nervous system, that is brain and spinal cord. But when it comes to Schwann cell, one Schwann cell can only cover a small segment of the axon. Like here, this is one axon, but you see we need 3 Schwann cells to cover one axon. This will cover the middle part, that will cover the distal part, this will cover the proximal part. Therefore, on one axon, in the peripheral nervous system, you're going to find 10 more or even 20 or 30 Schwann cells covering just one axon. Therefore, we have more Schwann cells in the body than oligodendrocytes. But at the end of the day, both cells form myelin sheath. One forms myelin sheath in central nervous system, the other myelin sheath in the peripheral nervous system. So that's about myelin, oligodendrocyte, and Schwann cells. What about ependymal cells? Ependymal cells, these are cells that are lining the ventricles. Now, in the brain, we have small cavities. There in blue, we call those as ventricles, cerebral ventricles. There are 4 in total. The third and fourth is not shown. Here we're just seeing the lateral ventricles, left and right, the largest ones. These ventricles produce what we call cerebrospinal fluid. Produce cerebrospinal fluids because in each ventricle, there are special capillaries which we call colloid plexus. The colloid plexus is where cerebrospinal fluid is made from. Now, those colloid plexus, or simply the capillaries in the ventricles, they are also covered by ependymal cells. These are the cells here in purple or pink. So the ventricles are covered with ependymal cells. Within the ventricles, we find special capillaries known as colloid plexus. Together with the ependymal cells, they produce cerebrospinal fluid. Now, these cells have cilia. You can see those processes there. Apart from producing or helping to produce cerebrospinal fluid, ependymal cells help in flow of cerebrospinal fluid. Come in. All right, so we're saying ependymal cells help to circulate cerebrospinal fluid to the brain and around the spinal cord. Now, if cerebrospinal fluid is not mobile, is not moving or flowing, that's when we see problems like hydrocephaly, because the fluid begins to accumulate in the ventricles expand, and therefore make the head to become big, especially in babies when the sutures have not yet closed. But hydrocephalus, even in adults, it can occur. For example, if there's a tumor in the ventricles blocking the flow of cerebrospinal fluid, then that adult will have hydrocephaly, except the head will not grow, but they have serious headaches and requires correction. The tumor has to go so that CSF can flow. Next cell we'll look at is satellite cells. Now, these cells are not found in the central nervous system. They are only found in the peripheral nervous system, but they are part of the nervous tissue. We call them satellite. So satellite is something that is distant but overlooking on another object. For example, the moon is considered as a satellite of Earth. Okay. Now, these cells are found only in the peripheral nervous system. This is spinal cord. The spinal cord ends here. Then the nerves coming out, these are axons. The axons or nerves coming out of the spinal cord form peripheral nervous system. Even the nerves coming out of the brain, going to the eye, going to the tongue, going to the ear, we call them cranial nerves, but they are part of the peripheral nervous system. So, in the peripheral nervous system, we have parts where we find cell bodies. We call them ganglions. So, for example, this is a ganglion. You can see cell bodies. Cell body, cell body, cell body, cell body. Under normal circumstances, cell bodies of nerves should only be found inside the spinal cord and the brain, because there they are protected. But certain nerves have their cell bodies outside the spinal cord and brain, and those require protection. So the structure that protects them, we call it ganglion. So we have more cell bodies there. Now, these cells, because they're outside the central nervous system, outside spinal cord and brain, they are guarded by satellite cells. So satellite cells are acting more like astrocytes in the brain and spinal cord. So these are the cells you are seeing in pink. They are covering the cell bodies only because they know once a cell body dies, this cell is gone. And the function it was controlling is lost. So that's why we have satellite cells only found in the peripheral nervous system. So function is similar to astrocytes. We saw that astrocytes were acting as blood-brain barrier, providing nutrients, protecting the cells. That's what satellite cells also do here. Next is microglial cells. Now, microglial cells are macrophages. Microglial cells are macrophages of the central nervous system. Okay. We said macrophage in connective tissue is there to eat anything that is foreign and cells that are dying. Now, in an event that bacteria from blood vessels, this is a blood vessel, finds its way out of the blood vessel, then goes into the brain, starts playing around here, it will be identified by microglial cell, which is shown here, and be removed by the process of phagocytosis. So microglial cells are simply phagocytic cells. These are cells that protect the environment of the brain from any kind of microorganisms. Okay, then other white blood cells can follow, but first, microglial cells would have dealt with that infection. Okay. Other than that, we look at maybe meninges. So meninges, these are outer coverings of the brain and spinal cord. So there are 3 layers of coats that surround the brain. I'll use a diagram for simplicity. That is the skin on the skull, that is aponeurosis, connective tissue. That's why in the head there, the skin on our skull can move back and forth. So it slides over this structure called the periosteum. Okay. Now, between periosteum and the skin, there's a thin layer called the aponeurosis. There's an aponeurosis between the skin and the periosteum. That aponeurosis allows the skin on the skull to move back and forth, okay, so that we don't easily injure our skin. Aponeurosis is connective tissue around the bone, so it attaches the skin to the skull. The moment we remove the skull, we find now another layer of periosteum, the inner periosteum. So there's outer periosteum and inner periosteum. After the inner periosteum, that's when we now find the first layer of the meninge. So the first layer of the meninges that is closest to the bone is the dura mater. So dura in should be Latin or Greek means tough matter, a matter that is tough. So it's a very strong tent, very tough. It prevents friction of the brain tissue against the bones. So it is the strongest of all meninges, dura mater. Now, next to the dura mater is the arachnoid mater, which is shown here in gray. That's the arachnoid mater. Now, between the dura mater and the arachnoid mater, there's a small space there. We call that as the subdural space. Subdural space. Space between dura mater and arachnoid mater. So arachnoid mater is a bit strong, but really something that tears off most of the times. Now, within the arachnoid mater, so arachnoid mater is loose connective tissue, as you can see there, and it has a lot of blood vessels in it. Okay. Next to the arachnoid mater is the pia mater. The pia mater is the softest or weakest of all meninges, and is always attached to the brain, the surface of the brain, the one in red here. That is a pia mater. Now, between pia mater and arachnoid is this space known as subarachnoid space. This space serves as a route through which blood vessels will pass in and out of the brain. You can see here, this is a vein leaving the brain going to the heart. This is an artery from the heart going into the brain to bring blood vessels. So all of them will be located into the subarachnoid space. Other than that, it is within the subarachnoid space where cerebrospinal fluid flows. So cerebrospinal fluid in the brain and spinal cord is found in the subarachnoid space. And that way, because it is fluid, it lightens the brain. So the brain is always floating in cerebrospinal fluid in the subarachnoid space. Now, you've heard of strokes or cerebrovascular accident. When a patient has cerebrovascular accident, they have simply subarachnoid hemorrhage, because that's where the blood vessels are. So bleeding, you not find it in the subdural space. It will be found in the subarachnoid space. That's where the clot and the hematoma will form. Then it starts to compress on the brain. So that is subarachnoid space. Okay, shown here, similar diagram, subarachnoid, dura mater, arachnoid mater, pia mater. So that is explained already. Now, in the spinal cord, the arrangement is slightly different. The dura mater in the brain has two layers. Dura mater in the skull, dura mater in the skull has two layers, outer layer and inner layer. But dura mater in the spinal cord only has one layer there. So In the skull, we have the outer layer and inner layer of dura mater. The outer layer is called periosteal layer because it's close to the periosteum of the skull. Then the one that is inner, we call it the meningeal layer of the dura mater. So that's why the dura mater in the skull is thicker than dura mater in the spine or vertebral column. This is what we are seeing here. Dura mater, you can see, very strong. Space between arachnoid and dura mater is subdural space. Then that is arachnoid mater, light. Space between pia mater and arachnoid, we call it subarachnoid. That's where all blood vessels are located, even in the spinal cord. So that is spinal cord. Then these are nerves leaving the spinal cord. So when they leave, they form one thing here, which we call now peripheral nerves, forming the peripheral nervous system. Then we saw ganglion here. This swelling is created by cell bodies inside there. They are cell bodies of axons, which are protected by satellite cells. Okay. Then this is also clinical application, is for your own reading. Injury to nerves is called neurotemesis and the likes. Then this is healing process of nerves. You can read through these segments to just understand. So it takes about 3 months for a nerve to heal after injury. A nerve, by the way, you say the nerve is a collection of axons. The neuron is cell body, dendrite, and axon. So when a nerve is injured, which is essentially just an axon, when it is punctured there, what follows next is the myelin cells, that is oligodendrocyte and Schwann cells, will help to mend the axon. So axons can heal. But if the nerve is injured there on the cell body, that cell dies completely. So it takes about 3 months for the nerve to heal. Then now to restore its original function takes time, even a year plus. So nerves take time to heal. So that's where we end for today.